Hi friends, this is Colonel Pradeep Pindyala. I'm Professor of Anesthesiology at Ashram Medical College, Eluru, city of Andhra Pradesh. Today I'm going to talk about communication skills. Please pay attention. It will be very informative and useful, both at your working place and, and in the society where you live. Communication skills are a must as a doctor. So let's go about it. What is it all about? Uh, Developing strong communication skills is integral to becoming effective healthcare provider. In recent years, good doctor-patient communication has been linked to improved patient satisfaction, better patient care, and decrease in malpractice lawsuits. If you are a very good communicator, the lawsuits against you may be diminished. It helps to diagnose and treat the disease, establish, maintain a therapeutic relationship, and it provides information and education. I'll tell you about more about communication skills. I'll make you expert in communication skills within 20 minutes. It's an assurance. Let's see. It's interactive, dynamic, reduces uncertainty. It's a planned approach. It's a welcome practice, and you should welcome feedback once you're dealing with your patients. How? I'll tell you. Verbal communication skills are normally, it has a structure, it builds relationship, it initiates a session, and it gathers information. If you have got good communication skills, invariably, you will have wonderful, you can gather so much of information from the patient, what is happening, and you can get a better history taking and come to a correct diagnosis. Treatment is obviously correct if communication has been better and history taking is better. Explanation and planning and closing the session. When you're closing the session, you make sure how much he has understood. See how much he has understood the discussion. Always maintain an eye gaze and eye contact. That's very essential. Head movements, facial gestures, everything is important on yourself as well as the patient. The body language. Body language is patient easily understand. You can understand what is happening in your mind and how your posture, everything. Patient notices. Make sure you maintain a good posture and good relationship. When you're communicating with your non-verbal communications like gestures, interaction, or this and that. Its acronym is CLASS. Normally, when this thing C stands for context, the physical setup of the area where you have interviewed the patient. Listening is very important. It's paramount. Half the problem is solved if you're a good listener, active listener, genuine listener. Acknowledge, validate when you're addressing their emotions and concern. Patient has come with emotions, known concern. Validate it, acknowledge it. Strategy to provide management plan that the patient can respond. Summary. When you have finished your conversation, the thing is you must summarize what has he understood or not, how much he has registered, has he understood in his own language and at his frequency. That's very important. Choose a physical area, preferably a private conversation. Not very important. Patient loves to have it. It's privacy. Private conversation with the patient is always better. The patient should be seated closest to you. Eyes should be at the same level, neither high or low. Present a relaxed demeanor. If you are relaxed, the patient should be relaxed. Maintain eye contact always. Only touch non-threatening areas. Hand for be aware about the cultural aspect of your patient. Some people don't like even being touched the hand. In that case, you avoid. Otherwise, most of the patients love to be touched and when you're talking to them. Listening skills. It's an art, it's a skill. Medicine is an art, communication skill is an art. You have to develop it. And half the battle is won by improving your listening skills and paying attention to what is being spoken. Allow the patient to speak about without interrupting. That's very important. Don't interrupt him. Not to let the patient know that you understanding, listening driven. Nod your head. That's very good of acknowledgement. If there are time constraints, let the patient know. Don't suddenly disappear and leave the conversation. Tell him that you're in the paucity of time. Make him understand. Even understand. He would love that. But don't disappear just like that. Identify. Uh, your acknowledgement of emotions best should be empathetic attitude, not sympathetic. Nobody likes being pitied upon. They love to be empathized. Empathize means empathetic attitude, putting yourself into patient's shoes. That's very important. You feel that you are the patient. You understand it. Once you imagine yourself putting yourself, you are lying on the operation table. The same feeling, how scared you must be. The same feeling the patient must be under. Try to understand his emotion, concern. Identify the cause of his emotion, respond by showing you have made the connection between emotion and cause. Don't have the same feelings as the patient. Why? I'm saying the patient is anxious. Don't become yourself anxious. At the same time, understand his emotions. That's very important. Doctor, you're a doctor, you're not the patient. The plan, strategy is very important. Appraise, clarify for the patient. The expectations, treatment, and outcome is different always. Decide what is the best medical plan that would be for the patient. Recommend a strategy and how to proceed about it. Evaluate the patient's response. See how he is responding with your discussion. Collaborate and agree for a plan mutually with the patient. Summarize. When you are talking to the patient, always summarize. See that the entire discussion has been registered in his mind in the language he understands the best. Summarize the discussion in a clear, concise manner. Check the patient's understanding. Ask if the patient has any other questions. Don't be in a hurry to leave with your discussion. Ask him, does he have any more questions? Clear contract and follow up with it. Encourage follow up with it. Emotional conversation is very important. Be prepared, expect emotion. Patient has come with a lot of expectation. Fear for his future. What will be the outcome of the surgery or the ICU management, critical care situation of his wife or his children, surgery. He's worried. Have a plan, monitor what you think and feel, practice self-regulation. Aim to turn the confrontation into conversation, even with your colleagues. In the working place, confrontation can be converted to conversation by your communication skills. Know when not to have conversation. I said listening is very important. Talking can be stopped. If it is not necessary, don't talk. Listening, eyes and ears should be always open in good conversation. Mouth need not be all the time open. Of course, you must talk, but not necessarily all the time. Use non-judgment listening. Don't be biased or prejudiced. You should be non-judgmental listening. Remember, it's about the patient or their attendant. Maintain the eye contact. Listen without interrupting, only making clarifying statements and paraphrasing. That's all. Avoid trying to make a situation better when it is great. If the situation is high risk, surgery, don't tell that nothing will happen. God forbid anything happens tomorrow. You may be violent. That's how violence in hospitals and against doctors take place. I'll tell you how to avoid it with your communication skills. More to it. If an anger to patients or their family response, wait at least a few seconds before you react. Calm down. If he has said something foul or abused you or insulting word, don't react immediately. Pause. Few seconds. Be calm. Then reply to him. Avoid being defensive and blaming. Being defensive, the patient feels that you have done something wrong. Don't be defensive, at the same time, don't be offensive. And blaming game is to be avoided. Don't say that you have done the mistake. He has lost somebody. Don't say that you had done the mistake. He will react badly. Blaming game to be avoided. Acknowledge emotions by empathizing. I already mentioned, put yourself into his or her shoes. When emotions, behaviors escalate, you feel threatened, unsafe, and then tragic. When the situation is escalating, the violent behavior, avoid further interaction, leave that place, be safe. Doctor-patient relationship. Patients do not fail treatment. Treatments fail to benefit patients. I repeat, patients do not fail treatment. treatments fail to benefit patients. Most patients are anxious. Physicians should instill confidence in the doctor-patient relationship. It's in itself therapeutic. Half the disease treatment is done if you have good communication skills. That's very important. What is this? It's slightly confusing slide. Every word you will understand within seconds. Patient control, low, high. Doctor control, low, default, consumeristic, doctor control, high, paternalism, mutuality. You'll understand. Next slide. Paternalistic attitude is you playing a role like a father or mother. Surprisingly, patient loves it because he doesn't have to worry for himself. A paternalistic or guidance cooperation relation involves high physician control, low patient control. Here, the doctor is dominant and acts like a parent who decides what he or she believes to be patient's best interest. Some say this surprisingly, patient derives considerable comfort, being able to rely on the doctor in this way, being relieved of the burden of self-worry and decision making. What is mutuality relationship? The relationship mutuality is characterized by active involvement of the patient as well as with your consultation. Here, both parties participate as a joint venture. Doctor brings his or her clinical skill and knowledge, and patient brings his own expertise and experiences. That helps sometimes. Consumeristic attitude should be not encouraged. Here, the roles are reversed. The patient becomes the boss because he thinks he's a consumer, he's paying you. So he has the right to have so many things. Don't encourage that. A consumeristic relationship describes a situation which power relationships are reversed. Here the patient takes the active role, doctor adopting a fairly passive role. Don't encourage. The patient accedes to the patient's request. The doctor accedes to the patient's request. For second opinion, हमें second opinion चाहिए. Refer me to another hospital, write a sick note. So don't encourage that. Default relationship. In default, suppose there is an emergency, doctor should be dominant. There you don't become passive and ask his opinion. In a situation, by default, that there is an emergency situation, you have to be boss, decision making in the safety of the patient, better outcome. However, in other situations, patient can be more actively involved in treatment choices. Duties of good doctor. What is bad doctor? I don't want to comment on that. You shall have lots of knowledge, skills, and performance. Right now, you are doing participating. ISACON 2021 at Ahmedabad, both at hybrid as well as on ground to improve your knowledge, skills, and your performance. That's the best thing. Take care of your patient, make it his first concern. Provide a good standard of practice. Obviously, the more you read, more you earn skills, acquire knowledge, better treatment for the patient. He'll be happy. Be safe in your hand. Protect and promote the health of the patient. Take prompt action, patient safety as well as dignity. Communication, partnership, and teamwork. See patients as individuals, not hernia patient, patient. He's an individual. Respect his dignity. Respect patient's right to confidentiality. Don't start discussing about his problem with others and his friends or somebody else. He may feel bad, awkward. Confidentiality has to be maintained, privacy has to be maintained. Work in partnership with the patient. Work with colleagues in the ways such that the patient's interests are also taken. With your colleagues also help, the patient's outcome is always better. Maintaining trust, be honest and open. It's very important to have integrity with the organization, with the patient's relationship. Everything is a part of communication skills. Never discriminate unfairly against patients, your colleagues. Never abuse your patient's trust. It's very essential. What are the barriers in good communication? For a doctor, if you are authoritarian, bossy, dismissive attitude, hurried approach, you never get good outcome. Use a jargon. Don't start using medical terminology. Jargon which he doesn't understand, syndromes or some diagnosis. Doesn't understand. Make him understand in the language he understands, preferably in his own language. Unable to speak first language of the patient, definitely a hurdle. No experience of patient's cultural background. You know the patient's cultural background always helps. The patient anxiety, reluctance to discuss sensitive or trivial use, misconceptions, conducting sources of information, cognitive impairment. He's not as intelligent as you. Come down to his frequency of insight. He would have invariably hearing, speech, visual impairment. You have to accept that. Section 13 of Indian Contract Act 1872 says two or more persons agree upon the same thing in the sense they are said to have consent. Any person who is conscious will give a consent, mentally sound, more than 12 years. When the consent is not valid, under fear, duress, fraud, misrepresentation of fact, the person who is ignorant of the implications of his consent, who is under 12 years of age, consent is obviously invalid. Depending upon the circumstances, it could be implied, verbal, written, informed consent. Conflict in workplaces very strangely connected to communication skills and the better outcome. Managing conflict in the workplace is a time-consuming, necessary task for physician. Conflict may exist between physicians and staff, between staff and patient, or with patient family. Conflicts have an adverse effect on productivity. No doubt about it. They may result in high employee turnover. The workers who are working as an employee start leaving their work or job, going somewhere else. Or sometimes they limit staff contribution, and that their absenteeism, other things, that will impede the efficiency of the outcome. Disruptive physicians should not be encouraged. Identify them. The people who have negative attitude and negative thinking about the treatment and management and our method of management. The case or surgery or giving anesthesia, such people should not be encouraged. Dysfunctional physician presents an insidious cause. Many factors. This increases the stress in the work environment. Once the dysfunctional behavior pattern is recognized, intervention must be made. When confrontation is necessary, a team approach should be used. Empathy should be expressed, but change must be demanded. The communication should be direct and clear, with the subject not given an opportunity to respond until the end of dissertation. However, individuals who have a destructive effect on the workforce should be asked to leave before they cause harm to you, patient, and to your reputation. Prevention of conflict. To prevent conflict, our professional code of conduct should be established, not only in the hospital, also as part of group policy, medical staff bylaw. Ground rules make it easier to discipline, as they take personality out of the equation. Everyone needs to understand that there are firm limits of inappropriate behavior. There are limits of it beyond which cannot be tolerated. Understanding how conflicts arise is important for its prevention. Emotional intelligence or emotional quotient, very important communication skill. Emotional intelligence has been recognized as necessary not only to be successful as a leader, but also to be successful in your own life. Everywhere you can be successful provided you have emotional intelligence. Involves self-awareness, management of emotions of your own, empathy, people skills, and motivation. Development of interpersonal intelligence allows understanding of other people. Once you understand yourself, your own emotion, then making control of others' emotion will become very easy. Interpersonal communication. Communication in the medical act is an art, it's a medical act in an active process of reception of information and active listening skill. Half the communication is listening properly, and that's a skill, that's an art. Sincere effort, paying some time, giving some valuable time for listening. Very important. Medical domain communication represents fundamental clinical skill. The fundamental clinical skill, communication skill, quality of information obtained with the doctor during consultation, closely linked to their communication skill. In the communication with the patient, listening, given time are elements that must maintain attention to the speaker. First, the listening must be active, with no second thoughts about it. Particular attention must be given to the non-verbal component. I said the body language. Use your imagination and intelligence to read the person's spotlight. Better communication. The part of communication, adopt open, patient, and calm attitude. Eye contact is a must. Facial expression must be monitored, both on yourself as well as your frustrated, unmotivated patient. Same as you on yourself also. You should think about it. The listener must be empathetic, not sympathetic. Put yourself in it. The issues, you'll understand it better. No physician, however conscientious, they're very careful person and careful can tell what and which are maybe the object of some undeserved attack, malicious accusation, blackmail, or suit for damages were none of his faults. Doctors were once highly respected the patient. However, it's become extremely rare these days. They are increasing being subjected to verbal and physical abuse at the workplace. They are increasingly being subjected to. Moreover, the situation in India is worse in the world, although it is all over the world. Statistics and violence, 8 to 38% health workers suffer physical violence. 1.6 million people die due to poor quality and bad infrastructure. Highest rates of violence occur in obstetrics and gynecology, next medicine and next surgery department. 75% of doctors face assault at the workplace. 70% of doctors feel unsafe by situations. Very unfortunate. Violence against doctors is not just confined to India. It's a worldwide phenomenon. Acts of violence are mainly verbal and physical and occur both in hospitals and private clinics. Western world, patients, relatives are the people who are harmed. Same in India. Physical violence, mob lynching, intimidation, cyberbullying, abusing, verbally harassment by the police and politicians, blackmailing, mob lynching, part of violence. Very unfortunate. True. Causes of violence, poor quality health care in the majority of the government sector. The negative image of doctors and the role played by media is very destructive. Media, villainous role they play occasionally. Poor socioeconomic status of the patient. You can't afford your fees and the cost of the surgery. Poor communication, vulnerability, susceptibility to hospital. Law awareness and knowledge about health-related issues. Lack security, inadequate security arrangements, especially in government hospitals. Mob mentality, instant justice by the patient and their relative that causes harm. Violence against doctors, attack the patient's relative. You have studied for 10 to 15 years, despite that, you see, face violence against you yourself. You don't have personal, adequate family and social life, harassment by police, politicians, poor infrastructure for most government institutions. In fact, draconian laws against doctors, very unfortunate. The consequences, violence on the doctors, they become depressed, they may have insomnia, post-traumatic stress disorder, they may have PTSD. Agoraphobia, this is fear of the crowd, and then there are many people standing, you get scared. The doctor can develop agoraphobia. Very unfortunate after this violence incident, often leading to absenteeism from the work in short term as well as long term, loss of productivity, long term. Stamp approach, what is it? Warning signs of violence. It happens that interestingly, stamp is staring, tone, anxiety, mumbling, pacing. The person is staring at you, he may become violent. If the tone and volume is increasing, he can become violent next. If he's showing anxiety, next is violence. Mumbling, if he is mumbling, he can become violent. Pacing of the relatives are pacing up and down. Next, attack you. Prevention of violence. The rise of mob violence incident, doctors are also becoming cautious and reluctant to take serious and grave cases. Patients now, doctors are reluctant to take serious and grave cases. Very unfortunate because of mob violence incidents. This in turn compromises healthcare and defeats the purpose, very purpose of healthcare delivery system. Very unfortunate, but true. Unless we make the hospital environment free from fear and violence, nothing can improve. Knowledge dissipation is very important. General public should be educated about the diseases associated with health issues, especially through media. Media should play a positive role, not a negative role. This will generate health awareness and equip patients with knowledge that will be useful for them, their own treatment. Strengthening primary health care is very important. If the PHCs and sub-health centers are well equipped and have a good infrastructure, tertiary care treatment need not be, patient need not be transferred to tertiary care hospital. This would significantly reduce the patient load in the tertiary care hospital, medical college. This will help to improve doctor-patient relationship, promote greater patient satisfaction. Communication and empathy, I have told again and again, studies have shown that effective doctor-patient communication is correlated with higher patient satisfaction. Spending a little more time will do the job. Workplace safety is paramount. A safe work environment and congenial atmosphere for doctors will significantly enhance their efficiency to deliver quality healthcare to the patient. Therefore, the hospital administration will make changes to the physical environment. Very important. Proactive media. Media should be proactive. Media may be considered to be window of the society. Plays an instrumental role in bringing to light the happenings of the healthcare system in our country. Therefore, it is obligation of the media to cover the positive news of the medical profession and not just the negative news, and should avoid sensationalism. That's very, very essential. They should also desist from media trials of the doctors. Suppose something untoward happens, they should not start trials of their own on their news channels. This should be left to the courts rather. Security and monitoring is very important. Security in government hospitals is grossly inadequate. There is an urgent need for more guards to regulate the admissions of attendant patients into the hospital. CCTV cameras should be mandatory. It's very important. That saves so many lives and avoid this violence against doctors. In case of an outbreak of violence in health setting, the police should respond swiftly. Moreover, warnings about violence against doctors should be displayed at all hospitals. Political interference is really painful, but it happens very often. You keep seeing it in the media. Politicians should refrain from interfering with hospital matters. They should also discourage VIP culture prevalent in government hospitals. There are many acts of violence doctors are perpetrated by individuals having strong political culture. That is very bad. Strict punishment should be given and conviction for violence against doctors. Medical Protection Act (MPA) has currently been implemented in about 23 states. Incidentally, I'm working in Ashram Medical College, Eluru City of Andhra Pradesh, and this was the first state to implement MPA in 2007. As per this law, any violence against doctors should be treated as a non-bailable offense with a fine up to 50,000. Now it's more. Jail term up to 3 years, maybe. Now it's, I think, increased to 10 years. Doctors' attitude, there is a need for a change in the attitude of doctors. Sometimes arrogant behavior and condescending attitude, I said bossy attitude, displayed with the doctors, altercation. Avoid it. Have better communication skills. Be empathetic. Every medical profession should receive adequate training in anger management, stress management. In case of volatile situations where violence can erupt, important for the doctor to be vigilant. Importantly, the doctor should not respond to anger with anger. That's very unfair, isn't it? Role of medical schools, I mean colleges, medical schools, medical colleges. The medical colleges can play an important role in creating awareness about workplace violence against doctors, and how to react and how to control it. Along with the medical subject, they should also teach about patient-doctor relationship, communication skills. The patient is an effective way and empathy towards patients and their relatives. This medical college should also teach them how to handle tactfully. They should teach them how to remain calm and responsible during such occasions. Role of the hospital, improvement of the services, employment of adequate number of doctors, infrastructure, improvement in them. In summary, I would say the primary objective of the doctor is to listen and listen to the patient in order to be a real problem. You will find the real problem actually by listening instead of simply eliciting symptoms and signs. Shared decisions making between the doctors and the patient will determine the most appropriate and best course of action for an individual patient. Communication becomes increasingly more a therapeutic technique, a clinical skill that creates fundamental relationships and that can provide benefits hugely. The medical curriculum should include soft skills and communication skills, very much essential in medical colleges. Communication skills should be taught. Both doctors and patients have a role to play in avoiding unnecessary violence by improving their communication skills. Thank you for patient listening. I hope it was useful. And now I am closing the session, but you're most welcome to ask me as many questions as